much everyone for coming today, the fourth talk of Climate Week. So it's very, very lovely to see you here. We've had a really great response throughout the week, so I'm glad it's been kept going. As some of you might have seen, unfortunately, Prof Johnson isn't going to be able to join us today. However, we have the very, very wonderful Dr Magaly Aceves Martins, who's come to step in and talk to us about behaviour change in sustainable diets. For everyone viewing online, just so you know, and everyone knows that all of the talks are being recorded and you'll be able to access them at the end of the week if you want to see anything again, and they can be distributed a bit more widely as well. So without further ado, I'll pass you over.
Thank you very much. Just make sure everything is working. Okay, cool. So, well, nice to meet you, everyone. Thank you so much for the invitation. I know that you were expecting to see Professor Alex Johnston, but well, I'm replacing her, so it's really good to see you, and I'm really excited to be part, so thank you for calling me out. And well, in this talk, I would like to cover like behavioral change and sustainable diets, which I think it's like a huge thing right now. So before starting, I would like to introduce myself a bit. I am a research fellow at the Rowett Institute, and I am currently doing some research on how ready Scottish people is to change towards a more sustainable diet. But also within this research line, I'm also trying to identify like some kind of barriers or challenges that people are facing to adopt healthier and more sustainable food options. And throughout this talk, I would like to mention like 5 main points. Would be like the climate change, biodiversity, and the changing diets. Also to define what is a sustainable diet. And to share with you a bit of the research we have been doing on food choices that are healthy, sustainable, but also affordable, which is like a major factor to consider food choices. And just talk a bit on the behavioral change challenges that we face as health professionals towards a more sustainable diet. And well, just like wrap the talk with some takeaway messages and conclusions. But before starting, I would like you to raise your hand. I would like to throw a question and just know. And probably as you have been following throughout this week, you are aware that the United Nations have this goal to limit 1.5 Celsius degrees above the pre-industrial levels. And they are expecting that GHG will peak by 2025, but they are expecting to have like a decline of the 43% by 2030 and go net zero by 2050. So I would like to know, and I know that people online can raise your virtual hand. So I would like you to raise your hand. Who believes that this goal is going to be achieved? No one. What about online? No one as well? Okay. So then I would like you to ask, who feels trained or capable of prescribing sustainable practices, either diets, daily activities, practices? One person. What about online? Anyone? Okay, we have a raised hand, so two people. Okay, so that's good. I feel with a bit of hope here. So that's good. So well, just like starting, right, like to talk about this kind of footprint, right, that we mentioned. So as you might be aware, in the last 50 years, there has been like this huge change in the food system in general. And it's estimated that since the 17th century, probably the lands that were used to grow crops or use it to agriculture has been increasing like for 5.5 times, which is amazing. And it's a bit blurry. I hope that you can manage to see. But in the graph, you can see that nowadays in this kind of habitable land, it's estimated that 50% is used for agriculture. So of course, like a lot of changes have been happening in the last decades towards that. And yeah, we're also facing this kind of cheaper food paradigm, right? Like the world is in need of cheaper food, but however, that implies that we will need more fertilizers, more land, more resources to be used. So it's like kind of a loop, right? Like we enter that we need cheaper food, but we're like kind of taking the earth towards like pushing it towards like really unsustainable practices. So really like research, like we're like debating where to kind of cut the cycle, right? Because and especially I think nowadays it makes more sense with all of the cost of living crisis that the prices of food are like skyrocketing. So really, where should we kind of cut this cycle? It's like the big question. And I really enjoy this piece in The Guardian that it was from 2021 by Dan Saladino, when he was like kind of launching this question, right? Like, are we eating ourselves to extinction? And he was kind of even telling like a really dramatic plot on how all our practices are like taking us to extinction. So mainly he was suggesting that all of these unsustainable practices that we have right now in our food system are taking us to reduce environment, so kind of damaging the variety of landscapes and habitats that, of course, damage the living or the welfare in these environments, and that includes like animals, but also kind of microbial organisms, which eventually lead to a decline in diversity, which would lead us to biodiversity loss, which it means like risk of extinction. And in this piece, he mentions that there's like this database where they have identified over 1,500 species that are like in a risk of extinction. So it's like quite, I would say like it's quite dramatic because he actually like kind of concludes that our current food systems are contributing to the destruction of our planet, which is quite worrying, I would say. But why food is so relevant? So the thing is that food is the single and strongest lever to optimize human health, but also the environmental sustainability and the biodiversity of the world. And just for you to have an idea, the global food system, it's one of the most significant sources of greenhouse gas emissions, and it is estimated that it contributes up to a third of the global emissions. And our global food systems are the primary driver of biodiversity loss. So nowadays it's estimated that agriculture alone it's a threat for over 86% of our species that are at risk of extinction. And literature agrees that food is a leading driver to climate change. But of course, most of the literature nowadays are focused on the production of food, but not really focused on the lifestyles, on how we, like cook food or how we consume food. So yeah, it's like there's a lot of evidence, but we also can identify like these gaps that are in research nowadays. And just like to show you a bit of the progress, and for example, particular right in Scotland, that we have had. So in the last 3 decades, we can see that the emissions in several kind of areas have been decreasing, like for example, in electricity or in waste. However, in 2 main areas that are really linked to food and food systems, we haven't done like a great progress, that is transportation and agriculture. So I think that this showcases you that we can do better, I think. And in this graph, we can also see that the greenhouse gas emissions of agricultural food systems are like kind of slightly increasing in general. But when we see like where does these greenhouse gas emissions come from, it's different. So for example, the yellow bars that you see in the graph are those greenhouse gas emissions that come from the farm to cattle, like the production side. Then the green bars are the greenhouse gas emissions that come from the land use to produce foods. And the blue lines are those greenhouse gas emissions that come from what is called the pre and post production, which means all of the greenhouse gas emissions that come from household consumption, waste disposal, food retail, food transportation, food processing, food packaging, fertilizers, or manufacturing foods. So as you can see, I think that we, and I say we as consumers, we're doing really bad towards decreasing our emissions when it comes to food. And I think that I should bring like this question, like how do we measure the sustainability of food? And of course, greenhouse gas emission, it's like the most frequently metric used to measure the sustainability of diets. And well, greenhouse gas emission, and probably you've heard this throughout the week, but it's a metric to compare the emissions from different types of gases based on their global warming potential. So it converts the amount of these gases to the equivalent amount of the carbon dioxide with the same warming global potential. However, I must say that this is the most widely used metric in research, and I'm not sure if it's quite clear because are the yellow kind of metrics. There are over 16 metrics that the European Union considers as metrics that can be measured from food, but also depends on where the references come from, because of course these are mainly European, but if you are, for example, revising literature from Americas, probably authors also consider energy use or pesticides use. So it's really like we have some metrics that are widely used, but there are so many things that we can measure towards the sustainability of diets that it's really vast. But several researchers have like kind of had this task of defining what's a sustainable diet. And it's widely agreed that greater than the 50% reduction in the global consumption of unhealthy foods such as red meat or sugary products could contribute to more sustainable diets. And also a greater increase, like they said, like greater than 100% increase in consumption of healthy foods like fruits, vegetables, nuts, legumes could also contribute to a sustainable diet. So in the plate that it's in your left-hand side slide, you can see what the Eat Lancet Commission came as a, like as a reference of what a sustainable diet should look like. And it's of course in the shape of a plate, just like the Eat Well guide plate that you have. And you can see that as expected, we're expecting to see like 50 or more % of the plate of fruits and vegetables. The yellow bit refers to whole grain cereals, and the rest includes like dairy products, animal products, even plant produced proteins, and even sugar. Added sugar is considered just to make it a bit more realistic and achievable. But when it comes, for example, within a specific context, and this is a graph produced by some work done by Professor Jenny McMurray from the Rowett Institute, when she wanted to model how a sustainable diet within the UK context would look like. So she used some linear programming to do these graphs. So she had the greenhouse gas emission of 82 food groups, and she wanted to kind of to model, right, like the perfect diet to reduce greenhouse gas emissions. So in a first attempt, she got like 7 food groups that would reduce 90% of the greenhouse gas emissions. But of course, they were like in really unrealistic quantities, and it was like this model was not considered the acceptability part of the diets. And when she considered the acceptability part, we call it constraints in the model, she came up with what you see here. So the lighter gray lines are what the current diet looks like, and the darker gray lines are what an ideal sustainable diet would look like. And of course, you can see that there are some shifts, changes in the, but to be honest, they will be like realistic changes. They are like nothing really massive. So that's like kind of the differences on what we actually are eating and what a sustainable diet would look in the UK context. But of course, I think that the message is quite similar across the evidence. And this graph comes from our World in Data, that is the greenhouse gas emissions across the supply chain in different. And as you can see, and again, I'm not sure if you can clearly see it because it's a bit blurred, but most of the animal origin products are the ones that are leading the table, with most of the greenhouse gas emissions coming from those. So again, the message is like quite steady in that sense, like we should limit this product if we really want to reduce greenhouse gas emissions. But from a consumer perspective, yes, like the most kind of effective method to reduce greenhouse gas emission, of course, would be consuming less of the most environmentally damaging products that are meat, dairy, and some imported foods, just considering the transportation, especially in the UK context. But also, for example, reducing our food waste would help, or consuming fewer calories. And I think, and I guess that most of you are health professionals, it's like a really good kind of message saying that these sustainable kind of goals are also aligned with what we consider as a healthy diet, nutritionally speaking, right? Like consuming less calories and reducing the animal origin products. But it's really interesting to see the citizen understanding of sustainability. So this data comes from a report of the Food Standard Agency from 2022, so it's quite recent. So the overall message was that people has like a low awareness of the environmental impact of food. For example, they are not aware of the low food miles or the importance of locally produced meat or organic and animal welfare. And nowadays, a really strong driver of food choice includes price and taste of food, and sustainability is not considered as a driver. And of course, there are some barriers to follow a sustainable kind of diet, which include costs, the lack of knowledge and awareness of what sustainable means, like in practical terms, the lack of availability as well, and the mistrust in labels, or really disinterest on the environmental impact. And regarding, and I will briefly mention regarding the labeling, right? Like, and as I mentioned earlier in the talk, like there are so many metrics that are accounted, and the data sometimes is a bit iffy of where we're getting the data to analyze the kind of impact of food, that there are no international agreed standards to build this kind of eco-labeling, or we have like no clue still on what data should be included in this kind of measurements. So I think that this is like, I mean, nowadays it's still like a big thing on how labeling on the nutritional side of products should be done. Now imagine bringing this into the field, it's like a massive thing because we still are not clear what information we should be showing to the consumer so they have like a real clear idea. And I really like that, like this example, sorry if it's not clear, but it's like a suggested kind of labeling of 2 dishes. Well, the authors did like labeling across several plates, but it's just only for... So in the left-hand side, you have the veggie lasagne, and in the right-hand side, you have the beef roll. And it's really interesting because they included 4 metrics of environmental impact, but 4 metrics on the nutritional side. So I think it's quite visual, and you can see which one is better, health-wise speaking, but also environmentally speaking. So, I mean, it's one suggestion, but again, I think that there's going to be a lot of research in this field, especially to see what people is understanding and getting from these kind of messages of different products. And I wanted to share some research that we were doing last year, because we were really interested to identify those products that had like the highest nutritional quality, but the lowest greenhouse gas emission and price as well, because of course we know that those are drivers of how of selecting food. And what we found, we were using the NDNS data from the UK, is that of course in the UK, and this was prior the cost of living crisis that we're facing, most of the items that are considered with the highest nutritional quality and with the lowest greenhouse gas emission and price are contained within the potatoes, rice, pasta, and other strategic carbohydrates group. And of course, if we kind of compare, like the graph that we build based on our food analysis to what is suggested by the Eat Well plate, you can see that there's a pattern, but it's slightly different. So if we bring price into the formula, it would be like really difficult to achieve really the guidelines, the national guidelines. So that's why we were like, like considering like, okay, we have a guideline, but we know that the other factors are not aligning. So what can we do, right? Like to make, but the good thing is that we also kind of run the same analysis like within each of the food groups. And as you can see, like in every single food groups regarding the nutritional aspect or the greenhouse gas emission aspect or even the price aspect, there's like a really, really long variability, which I think is a positive thing because gives room to making swaps within the food group. So probably suggesting to pick, like to choosing either cheaper and more sustainable and, like more nutritional fruits or breads, or we have room to play with these kind of choices. So that's a good thing. However, I need to highlight that in this food analysis, we also noticed that those items that were the healthiest, with the lowest greenhouse gas emission and the cheapest items, most of them were processed or ultra-processed. And again, if we're wearing like this hat of the nutritional side, where we're constantly saying to people, do not eat ultra-processed or processed food, but then we're using like, but you need to eat a sustainable diet, then the messages can kind of be a bit contradictory. And this is relevant. And I want to share with you something that we are doing at the moment. We built this interactive dashboard to explore the dietary, environmental, and cost data of UK diets using the NDNS data. So this is like the kind of the graph to showcase the average kilocalories per day per person consumed in the UK per food category. So we align the colors with the Eat Well categories, which is green for fruits and vegetables, yellow for cereals or other starchy carbohydrates, pink for any kind of protein food product, blue for the, dairy or milk-related products. Then we have purple for oils and fats, gray for drinks, and red for those items that should be limited, like sauces or like very sugary or salty items. So you can clearly see where our calories come from within a day. However, if we include the level of processing in the same graph, I think it's quite shocking to see that most of our calories come from the ultra processed foods. So again, we need to consider this when we're like even thinking on how to guide people, right, like towards sustainable diets. And again, when we consider like the total grams, the weight of food that people is consuming, it's not a surprise that the higher greenhouse gas emissions come from animal origin products. So again, I think that the message is consistent, right? Like animal origin products are those ones that are impacting the most when we talk about greenhouse gas emissions. And in the same line, when we consider like these kind of three items of sustainability, which are the nutritional quality, but the greenhouse gas emissions and cost, we wanted to see if like there was a pattern considering the characteristics of people. And we could see that those who are the most deprived consume less of those foods that are the most nutritious and have the lowest cost. So I think that this study also is kind of sending the message of how important it is to consider the characteristics of the persons, because it's really difficult to really try to achieve a sustainable diet if we do not consider the wider picture or the background of the individuals. So we have the theory, right, that says that there is a clear need to promote healthy and sustainable diets, aiming to improve healthy eating, but also to facilitate like fair and culturally appropriate and biodiversity-based sustainable diet. But then we have the practice that this aim can only be achieved if consumers adopt and develop several dietary changes, for example, reducing meat or dairy products. But realistically, these changes, for participants, might imply that they need much more time to be ready to make these changes. So it's really challenging nowadays to identify like novel pathways to enable this kind of dietary change towards like a sustainable diet, considering the cultural aspects and in general the socio-demographic aspects, but also considering this kind of ethical transformation, like to make it smooth to everyone, like consumers, but also like markets. So I think that challenge is still in the air, and we need to work towards really working all together. But when it comes to behaviors, of course, understanding the consumer behaviors is essential to really make an effective impact. And of course, it's essential also for developing these strategies, either educational interventions or any kind of interventions to try to achieve these diets. But it's interesting because, of course, most of the evidence that we have right now considers like the healthy diets aspect, where we know that there are some individuals who have the impression that they cannot fit their healthy eating into their life because they see it as a complex task, or they have time constraints or work duties that make them difficult to attain to a healthy diet, or they simply do not care about the impact like diets have over their health. So in terms of sustainable diets, we have less information in this end, but the question is, would these individuals care about the environment if they do not care really about their health? So that's like, I think, a big thing. However, for us as health professionals, I think it's a really good thing to know that healthy diets have the potential to be environmentally friendly. So there are a lot of documented evidence on the effects and the co-benefits that health and environmental co-benefits of sustainable diets. So in that sense, I think it's a positive thing. But again, I think, and I will stress a lot this point on how important it is to consider the barriers towards the adoption of sustainable diets, just because sustainability is like a really complex and multifactorial term. And also from a consumer perspective, sustainable food consumption might also produce like kind of a social tension. And we can see it nowadays, right? Like we get taxed for anything. If you decide not to eat like animal origin products, then you're a vegan or vegetarian, or depending on the types of your dietary kind of selection, you have already a tag. Or if you really like to experiment new foods, you're a foodie or a gourmet. And I think, yeah, I think it's quite interesting to see also this social part of the diets. And this adds like a pro-social aspect towards food also when considering this behavioral change toward a sustainable diet. So it's, like we need to consider behavioral approaches to really create a meaningful change and to change behaviors towards lower environmental impact diets. And it's really interesting because there's like these researchers that believe on food philosophy. So they bring into the table like this question, right? Like, what can be learned from consumers who are highly involved with food in ways that potentially challenge conventional lifestyles? For example, those consumers that only buy organic foods, like what make them choose only organic food? So can we learn something about this group that we can translate to a wider population? But it's really interesting because in this specifically paper, they're talking about what they classify as gourmets, which are this kind of people that really like to cook and have skills and really enjoy like going for the products and smell the products. But they highlight that it's quite interesting to see that most of what they would tag as gourmets are like male in their 30s or 40s with high incomes, and they love meat. So of course they are like kind of a cluster of people rather than the general population. So that's why, if like even they have like a really good kind of point on seeing what makes these people choose these products. It probably would be a bit difficult to translate it to kind of a populational approach because of course they're like kind of identifying these clusters of what people like when it comes to food. But it's really interesting to see that when we categorize the sustainable food consumption behaviors, there are several. So this graph comes from a systematic review where authors were trying to identify what behaviors towards sustainable food consumptions could be found in university students. So of course this probably graph showcases like probably a younger adult population, but it's really interesting to see that they identified behaviors in sustainable production and processing, also in food miles, like students trying to kind of reduce the consumption of food depending on the mileage where those foods come, or for example the packaging of foods, or even the dietary practice or the waste management. So it's really interesting to see how many behaviors within kind of the food consumption we can find, and we can make a change towards sustainability. And another like more recent thing, it's how do we really communicate with people, right? Like so I found this study which I thought it was like really interesting because there were like this group of behavioral scientists that partnered up with Unilever, that that they have like several products, and they undertook the largest online randomized control trial with over 6,000 people in TikTok and Instagram, which are like very popular platforms nowadays. And they were like measuring this in 3 countries, the UK, US, and Canada. And they were really trying to identify the different types of messaging in social media and the impact these messages have. And the intervention was through influencers. So imagine you are scrolling in, I don't know, in Instagram, and suddenly a person that you follow comes with this kind of announcement saying like, oh, for example, did you know that if food waste was a nation, it would be the world's 3rd biggest emitter? So reducing food waste is important. So what do I do to reduce my food waste? And they would give like these tips to people. And I think it was really interesting. So they look at the effect of using climate change campaigns like more like a climate pragmatism, which is more like focusing on the problem of climate issues. And also they measure the kind of climate optimism that is the solution focus. So they were like kind of framing the campaigns in these 2 ways. And others found that both had a modest but really robust and significant change. So using these platforms are very useful towards, like kind of sending and communicating And this was based on a previous study they had conducted on measuring the TV adverts and, like this kind of behavioral change towards more sustainable practices. And it's really interesting that they were asking like the percentage of what's the percentage that often turn to these options to trust information. And this was run over 3,000 people, and 27% confirmed that it was social media and the contents and creators, and that's why they selected like influencers. And for example, the content that they most think that it was like a positive thing towards a more sustainable life, people thought that it was like social media content, but also, for example, TV documentaries, news and articles, scientific reports, so it's quite interesting. But from this graph, I will also highlight like the first and, like where the people think that we have the most trusted information, that it's expert and scientist. And probably I will link this with my takeaway messages because it's really interesting, right? Like if I go back to the first question that I throw you, like no one believes that we will achieve the goals, which it's fair, but you need also to wear the hat of experts, and we really need to think that we need to progress and you need to send this positive message. So we also need to think that no one is currently being trained, and this is, like a common thing that we have in medical schools and nutrition schools, that no one is currently being trained as a professional to prescribe sustainable practices. But the thing is that people trust you. As you can see, like you are still experts. And even though you are like in a medicine or nutrition or even nursery field, like you are experts and people will listen to you. So you have like a room of intervention in that sense. And I think that the good thing also is that the message of a healthy diet is in line with an environmentally sustainable diet. So it's important to be reinforcing this message regarding, like this individual and consumers' dietary choices and the practices, and just include also this kind of climate crisis kind of vocabulary in your practice, because I think it's just like kind of adding up and making stronger the message. So also like kind of the suggestion is like to be part of these practices, right? Like including the environmental kind of language in your prescriptions, in your talks, making sure that we believe that small actions will help us achieve like bigger targets. And as you see in a previous slide, when we talk about food, there are several behaviors that we can change that will add up towards a more sustainable diet. And I think that we need to be very clear with people, saying that, of course, it's important their health, but also the planetary health. So reinforcing, again, the message, it's like vital. But it's also important to consider the background of participants, because in a way, like, if we're trying to reinforce this message of how important it's like an environmental, but if people cannot afford it, or, probably this will create like a stress on them, or, like this kind of social pressure. So that's why it's so important also kind of to consider with whom we are talking and the type of message that we are sending. So, like sustainable food consumption behaviors can change in different stages of kind of the food system. So all of them are valid. So just encourage, like the good practices so we can create like a bigger impact. So that's my presentation, and I wanted to give like some room for questions or ideas or anything that you will bring. So yeah, happy to answer any question.
Thank you so much, Magaly. So yeah, absolutely, loads of time to take questions. Does anyone have a question straight off the bat? If not, I could be greedy and ask the first one. Yeah, I'll pass you over the mic.
So I was quite intrigued to hear the data there about the most or the lowest producing greenhouse emissions being ultra-processed foods and things. Have you looked into, or has there been much work looking at the cause of that? Is it a true statistic, or is that down to things like offsetting and things like that? Is it a true comparison to say that that is?
Well, to be honest, I would say that it's tricky. So And I think that it again goes to the classification of ultra processed, because sometimes, for example, these kind of meat substitutes are considered ultra processed. So in one hand, we're like saying like, yes, go for meat substitutes, but in other hand, those are ultra processed. So I think that it has to do with kind of the categorization of things. That's the first thing. But again, it's how our diet is changing, like our pattern of dietary patterns are changing anyway. So in my personal point of view, I would make like an agreement, like saying like, okay, how do we make then these products healthier? And also assuring that they do not have like this impact on the environment, if that makes sense. Because it would be, I think, like unrealistic to say like everyone needs to change for a unprocessed food that it's very sustainable, because, for example, just considering fruits or vegetables in the UK, it's quite expensive. And some of them come from abroad, even Europe. So it also impacts the environment. So I think, yeah, it's just more about being realistic of the products we have. So yeah, that's anyone.
Yeah, I was going to ask, just because I've had a look at the Lancet. I think it's very difficult as clinicians to hand this information over to people, and even with not the extensive but a fair bit of reading, when I had a look at the Lancet plate, you do look at it and go, how on earth am I supposed to actually translate that into what I'm doing? Because the plate, it sort of has this tiny little sliver of meat or this tiny little sliver, and you're like, right, okay, so I'd have this little, it's quite difficult. Are there any resources that that perhaps give an example of, because even what would have been helpful is if it was this many grams of meat in a week rather than like this percentage of a plate in a day, and you go, I don't know how to. So I just wondered if you knew any better resources for.
Well, to be fair, I think there are no available, especially for clinicians or like even dietitians. It's quite tricky when considering the sustainable bit. However, I do know like some databases that can like really clearly showcase the greenhouse gas emissions of the food you're consuming, and some of them are quite interactive. So I will say that at this point of how research is, like kind of evolving, we have the other way around of what you're eating. We can estimate the greenhouse gas emission and probably, like create more conscious on that sense, like saying like, okay, you can swap this specific item rather than considering the food plate, because at the moment it's just like a full image of how ideally a sustainable diet should look like. But we know that nowadays it's unrealistic and barely no one is achieving it. So yeah, that's something to be done.
Yeah.
Yeah.
Any other questions for anyone in the room? The questions online?
Yeah.
One just coming up.
Is it? Wait a minute for that.
Oh, yeah.
Yeah, it's very interesting thinking about offsetting, especially with these kind of very big companies that are making highly processed foods, and
Yeah, but and again, I think that, I don't know, like clinicians or as health experts, we're normally thinking on, like industry as the devil or the bad ones. But in a way, we need to partnership with them, because otherwise it's very difficult, like to really get like good products, healthy products, and that are sustainable with sustainable practices. So yeah, I'm not sure if.
I think that one thing that has really been highlighted throughout the talks this week is that a lot of this research is really just starting to find its feet as well. So I think a lot of this is of sort of baseline awareness, and over the next few years, even just looking at the developing of packaging and things like that, it's quite interesting just to see the level of information that people are just kind of working on under the ground that's still to come.
And I think that an interesting thing as well, it's knowing that, like we still haven't figured out as researchers, like the healthy side of diets, like because we're still struggling on how to reduce obesity, how to make children to eat more food. And then this environmental side is also coming, so we really need to kind of sum up forces, because otherwise it's just difficult to kind of stay, like thinking on doing research only on the environmental side if you do not consider other factors. So yeah.
So we've got a question online. So wanted to ask about how information on supplementation for plant-based diets is approached by clinicians. In my experience, there's a lack of consistency, as I am a vegan and have different opinions by different GPs when asking about B12, etc. So there's other clinicians in the room who might be able to speak a little bit more to that, but certainly with regard to vegan diets and B12 supplementation specifically, I know that actually nowadays vegans are more likely to have higher B12 levels than non-vegans because vegans have such a high awareness of the fact that they might have a low B12. So most of the time nowadays, vegans will supplement their B12. And so actually their levels are fine. So if you are a vegan and you went to the GP wondering about B12, if they did your B12 levels and they were fine, then that's okay. If they were low, then you could take B12. I think it's generally recommended that if you are on a vegan diet that you supplement your B12. The B12 basically comes from the ground, from the soil, and the fact that we clean our vegetables so much is why vegans don't get any. But obviously because cows and other animals are down in the soil all day and eating that, we get it from them. So I hope that answers your... Would you have anything to add on that?
No, I think
Yeah.
that's really clear. And again, I think that, when it comes to sustainability, probably it's just not about, like how we are training clinicians or nutritionists or nurses. I think no one is being trained to kind of suggest sustainable practices, but, we have this event, so we are aware that the problem, of this problem. So, yeah, I would encourage just to use them in your own practice, just try to include them, as a regular thing, consider the planetary health as well.
Yeah. I hope that answers your question, Laura. Oh, yeah.
Thank you. I'm wondering if at the Rauer Institute you do, I don't know, some kind of outreach or for the general public regarding this, and so where do you find, is it just by going to the website or?
Yes, well, actually, I'm glad that we have Francine because of course. Yeah, but I think that probably please feel free to jump in, but I think that we're doing a great job through social media and email list and just reaching, for example, schools and community centers to kind of showcase the research that we are doing and try to show this kind of the importance of sustainability. But I don't know if you want to say anything.
The other thing I can visit our website for a lot of our information. All our events are posted on social media too. So, but we do a lot of outreach and engagement with different levels of people.
Yeah, definitely.
As well, so.
Because research, I don't know if that's enough to show the results of the research, just because there's so much information.
I know.
We're all bombarded with information, and people are looking for easy answers, an easy way out, and there's maybe not an easy way out, but there are easy tips or easy things to do. If you just say, just reduce. You don't have to totally stop meat, but reduce it, and kind of give guidelines, or so. Yeah. Well, I'll check the website maybe for more.
I think it's good to know, where people find that's what I found really interesting to see where people looking for information and who they trust more, and it's good to see that experts and scientists are on top, which it's a kind of a relief. But it's also interesting to see that people it's also going to social media to seek for advice. So yeah, I agree with you. That we need to look also how to be sure that information it's the trustworthy. So yeah. Definitely.
Yeah, I think that's something, again, I've been learning this week particularly, is that it takes so much time actually just to gather together the knowledge, which is all of these complicated graphs and things like that. And then it takes all of the amalgamation of all of those graphs, which takes so much time to then put it into something which comes across as so simple, but took these millions of years of making crazy graphs. So yeah, hopefully as we gather all that information, we start to amalgamate it in a way that's a lot easier. I think certainly for now it's reducing meat and dairy is a good place to start if you don't really know where to do that. And then from Dr. City Online, is there any standardised method of labelling food being developed to make sustainable choices? So I wonder if maybe Dr. City joined a little bit later, so might not have seen the...
Yeah, and well, the answer is no. And again, this is linked to the complexity of measuring, the environmental impact. There was this eco labeling happening in Spain, but there was a huge kind of backlash from industry, because of course some products like olive oil were being categorized as really bad for like for the environment, but something like pork, like pork products, like they were categorized as really, really kind of good. So I think it's really difficult at this point. And again, I think that the labeling needs to focus not only on the environmental side, but also the healthy side. So the consumer has like a clear insight on kind of the overall characteristics of a product. But yeah, I think the answer is no. There's no standardized method of labeling as of now.
Oh, hand up. Will we be able to hear him? So go ahead and ask your question.
You should be allowed to unmute.
Why are we going to do? Yeah, we'll turn that off. So you don't have to endure that. Please feel free to type your comment, Malgorzata, if you've got one. Any other questions for anyone in the room? Yeah.
Thank you. I was wondering if you are aware of any local sources of support patients could be referred to from clinician to in the community to help them to deal to better manage their diet, and for patients in general, but for more particular patients with diabetes or things like this.
Do you mean like towards like more sustainable diet?
Like any kind of diet.
Because I could probably hear more useful. Because I'm pretty sure that like as GPs they can refer it to nutritionists.
Yeah.
They can have like the full support.
Yeah, and I'm probably maybe some of the other doctors in the room can comment on, and Tim as well can comment.
Yeah, I can do that. So I'm an orthopedic surgeon to trade, and we often have people with sore joints who the reason they're sore is size predominantly. And if you put 5 times your body weight through your knee every time you take a step. So there is an NHS program called Healthy Helpings, which is run by Healthy Weight Grampian and through the specialist dietitians and things. It's essentially, my understanding of it is it's a prescribed version of Weight Watchers. That you can, but I think like everything in the NHS, it is under-resourced and probably full to bursting. But yeah, Healthy Helpings is something I'd suggest you have a look at. It's on a Healthy Weight Grampian website from my side. Thanks.
Yeah, there are actually, I think sometimes people don't realise that there are actually a lot of pathways that people can go through. So certainly with the endocrinology team, they have a health psychologist who works alongside that team, and they have dietitians that are involved as well, and people like that. So there are a lot of resource, but as Tim says, highly in demand. And from my past history of working in exercise medicine, it's very difficult once those interventions are over for people to maintain those results on their own. So that's really what we're having to figure out now, is because people tend to do quite well when they're receiving that intervention or having that intense period of time, but within a year it tends to be that people sort of fall off that wagon. So I guess that's what we're all just trying to learn, is how do we manage to get people to make changes that then actually, aren't even sustainable in the terms that we're talking about, but are sustainable in terms of they can keep these changes going on for the rest of their lives. I think.
For your own interest, the average BMI of a patient getting an operation in Grampian is now 28.
And that's in Grampian, not even in Glasgow. Yeah. Any final questions from the room? No? Okay, well, thank you so much for stepping in so last minute as well. We really, really appreciate it. And thank you everyone for joining us. Our last talk is tomorrow with Ben Durack, which is on the circular economy and what we can do with clinical waste. So it's been a real... is it just a last... Oh, she's got it. I think very complex issues is people need more information regarding even vegetable intake, is eating too much spinach or kale can block absorption. Oh yes, this is it. The more you know, the more trouble you find is that. Based on this conversation, which I believe is very focused on raising awareness, do you think there's more that could be done within the university? Is there a way in which all of this research and information can be shared with the wider uni community, seeing as the majority of people present at the moment are clinicians? Hopefully, Laura, this talk is here for the whole university. All of these talks will be widely available. So unfortunately, I think people just get overloaded with information, isn't it? If you give everyone everything, but certainly if you're interested, the information's there. And Prof Johnston, she has a really great platform where she puts a lot of her knowledge called Future Learn. I think in some parts of the university you can access that for free. In some places it's a paid for facility. So yes, but we'll close it off there. Thank you so much, everyone. And yeah, we'll just one last final round of applause for our lovely speaker. Thanks again, Maggie. Thanks, guys.